As a curious pet owner, have you ever taken to the internet for more information? Maybe you want to know why your pet is itchy and what you can do about it. Maybe you're frustrated about the ear infections. Maybe you're looking for ways to make veterinary care more affordable. Instead of wading through a sea of information that may not be reliable and in some cases may be harmful, here is what your vet wants you to know. I'm Dr. Brittany Lancelotti, board-certified veterinary dermatology specialist. Join me to get the information you're looking for to care for your pet. If you're curious about your pet, then your vet wants you to know. If your dog has been seen by a veterinarian for itching sometime since 2014, there's a very good chance you've been prescribed a medication called Apoquel, or at least you've heard of it. Apoquel is a daily oral medication for treatment of itch associated with allergies. And I've been really looking forward to doing this episode because pet owners are constantly looking for more information about this medication. The misinformation that is circulating on the internet regarding Apoquel is a huge reason why I started doing the show. I want to give you an evidence-based resource of reliable information regarding this drug. I've talked about my dog Russell Sprout in a previous episode of environmental allergies. And yes, this very special looking dog, who is the mascot for Your Vet Wants You to Know, has also taken Apoquel. He has been a challenging allergic case, but he's definitely been worth it. He actually won top prize in the So Ugly I'm Cute category at a local American Cancer Society fundraising walk. The most insulting part, though, is that we didn't even enter him into the competition. Like most pet owners, I have a concern about medication I give my pets. As you'll hear me say over and over again on this show, I needed to assess the benefit versus the risk, because there's a risk with absolutely every decision we make for our pets. For today's episode, I'd like to talk to you about the benefits and risks of Apoquel and why, as a dermatology specialist who has spent 3 years of my residency researching and publishing data regarding this specific medication and its long-term effects, I feel very comfortable using Apoquel in my patients with allergies. If you're interested in learning more about other medications and diagnosis and treatment of allergies, make sure you subscribe to the show so you can learn all about it. Full disclosure, Zoetis, the makers of Apoquel, have had me speak at educational conferences across the country. However, they were in no way involved in the research study prior to its publication, and they are not a sponsor of today's episode. Apoquel is an excellent therapy for itchy dogs, but it doesn't cure allergies. Let me say this again. Apoquel does not cure allergies. Allergies are a lifelong medical condition that we strive to manage, but we will rarely cure. As I discussed on the previous episode of environmental allergies, treatment falls into 2 categories. One is symptomatic relief with medications like Zenrelia, Apoquel, Cytopoint, Atopica, steroids that will help to relieve the itch, or 2, desensitization with allergy shots, which is the only treatment that actually works to fix the underlying disease. Having said that, Apoquel will stop the itch when it's being given, but if you stop giving the medication and you're not addressing the underlying disease another way, the itch is just going to come right back. So the medication is an excellent tool to provide our pets with relief while you're working with your family veterinarian or a veterinary dermatology specialist to search for the underlying cause of the pet's allergies, whether that's food allergy or environmental allergy or flea allergy. In other words, a prescription of Apoquel is not going to fix the problem. It's a helpful tool in our allergy treatment plan. A team-based, cooperative, communicative relationship with your veterinarian is your best bet for long-term success. When your pet needs fast relief from itch, Apoquel starts working very quickly, as fast as 4 hours after the first dose is administered. Compared to Atopica or cyclosporin, which is another commonly used allergy medication, which can take up to 6 weeks to start working, this is a really big benefit. Apoquel has an excellent safety profile compared to steroids. Prior to its development, veterinarians were relying on steroids if we wanted fast relief from itch. Steroids carry many side effects, including increased thirst and urination, increased hunger, increased panting, increased liver enzymes, increased risk of urinary tract infections and skin infections, increased blood pressure, muscle wasting, weakening of the joints and ligaments, just to name a few. Now, don't get me wrong, I use steroids and they work. As I've already said earlier this episode, every decision I make involving my patients is a matter of risk versus benefit. And so for some diseases, the benefit of using steroids will outweigh the risk. When I'm treating itch associated with allergies, Apoquel has a better safety profile than steroids, both short-term and long-term, and it works just as quickly. The incidence rate of adverse reactions was very rare, less than 1 in 10,000 dogs treated with the medication. And the adverse reactions included things like vomiting or diarrhea, lethargy, anorexia, some blood work changes. That's an extremely low rate of adverse effects. To kind of put this in perspective, according to National Geographic, that's the same odds you would have being injured by a toilet at some point this year. For patients who are receiving Apoquel long-term, I do recommend blood work prior to starting, and then at least every 6 to 12 months just to make sure nothing is trending in a concerning direction. We monitor much more closely if the animal is taking off-label doses of Apoquel. That means higher than 0.4 to 0.6 milligrams per kilogram of body weight, or being used twice a day, which is off-label use. Physical exams are required at least every 12 months in order to legally continue prescribing this medication. As I mentioned earlier, Apoquel can be used to provide relief from itch while you're searching for the underlying allergy. And this is great because the idea is to use Apoquel as a Band-Aid while you're searching for the underlying cause. I like using this medication during an elimination diet trial to determine if the pet has food allergies, since it can take up to 2 months for itch associated with food allergies to improve. Once a pet has started a prescription diet, I typically use Apoquel during those 2 months to make sure that the pet is comfortable. And as I get closer to the end of the diet trial to determine if there is a food allergy, before I introduce new foods into the pet's diet to see if they have a reaction to those foods, I'm going to have the pet owner stop giving the Apoquel first to see if the animal is itchy. If the itch is still there and the animal hasn't gotten any other foods, then I know I have a component of environmental allergies that I need to deal with. But if the itch is gone, then I'll talk to the pet owner about how to perform challenge feeding safely with the original food that the pet was on before the diet trial to determine if the food allergies are present. Then, if the itch comes back when we introduce other foods, I'll have pet owners restart the Apoquel just for a few days to provide fast-acting itch relief. Apoquel can also be used when you're investigating environmental allergies. So unlike steroids and antihistamines, the dog doesn't need to stop Apoquel prior to doing skin or intradermal allergy testing to determine what in the environment is causing the allergy. After doing the allergy testing, the pet can remain on Apoquel while those allergy shots are starting to take effect, which can be up to a year in some dogs. The long-term goal is to use the allergy shots to desensitize the pet to the underlying allergy so that eventually I can stop using the Apoquel or only use Apoquel during really bad allergy seasons for a certain proportion of dogs. Now, Apoquel may not be as effective for reducing swelling associated with allergies as it is with reducing itch. So if I have a pet that has allergies where their ears are completely swollen shut or their paws get horrendously swollen, a lot of times I'm going to reach for steroids and Atopica or another formulation of cyclosporin over Apoquel to provide better relief. Because Apoquel can affect the immune system, there is a possibility of an increased risk of infections. I have seen pets receiving Apoquel develop infections with Demodex, a type of mange mite. However, most of the common flea and tick preventatives on the market nowadays are actually effective against Demodex. And if your pet has any type of allergies, it really should be on an effective flea and tick preventative anyway to help keep any exposure to flea saliva from causing a flare of their allergies. I recommend talking to your veterinarian about what flea prevention is right for your pet. In addition, dogs with allergies will benefit from frequent bathing to help remove pollens they get exposed to and to repair their skin barrier, which is often abnormal. That bathing goes a long way towards helping reduce skin infections that they may be predisposed to because of the medications they're on. Side effects with Apoquel, as I said before, are rare in dogs. However, if your pet is one of the few that does experience side effects, that may be a drawback to using this medication, and different allergy therapy may be recommended. The biggest misconception regarding Apoquel I hear is that it causes cancer, and this is simply not true. I feel really confident saying this. Now, let me start by addressing the reason behind this misconception. Apoquel is a class of medication called Janus kinase inhibitors. These medications stop the transmission of signals called cytokines from outside of the cell into the cell. And in the case of Apoquel, the signal that it inhibits is one that causes the sensation of itch. Apoquel is one of 2 Janus kinase inhibitors currently being used in veterinary medicine. The other one is Zenrelia. There are many Janus kinase inhibitors that are being used in human medicine, and some of these drugs have been shown to increase the risk of cancer and others have not. So because they all share a similar mechanism of action, or the way that it works within the body, there's a concern that Apoquel could potentially alter the immune system in a way that allows cancer to develop. I published a large-scale research study in the Journal of the American Veterinary Medical Association in November of 2020 that answered this very question. One of the reasons I took on this study is because people were concerned and looking for answers. And for a while, I was using this medication in Russell Sprout, my allergic dog, and I wasn't satisfied with the information that was currently available in primary literature. So instead of taking to the internet and trying to wade through what's good information and what's bad information, I actually sat down and did my own research study. That study looked at dogs who had received Apoquel for a very long period of time. The minimum was 6 months, but some of these dogs were taking this medication for over 5 years. I compared that group of dogs to other allergic dogs who had never received Apoquel, but whose allergies are managed with other medications. One of the challenging and really cool things about this particular study was that I actually age and breed matched all of the dogs, which gave me some control over two of the biggest risk factors for cancer, which are age and breed. I wound up including 660 dogs in the study, which is almost unheard of to have a veterinary study this large. Generally, most veterinary studies look at maybe a few dozen pets at a time, so 660 is a huge undertaking. After reviewing all of the records for skin masses and diagnosis of cancer, I compared the two groups and found that there was no statistically significant difference in the development of cancer between the two groups of allergic dogs. Now, when pet owners are concerned that they read on the internet that Apoquel causes cancer, I can confidently tell them that I have actually done the research and have not found this to be true. But because every decision I make in my patients weighs the risks versus the benefits, I still do things to minimize the risk. So for Apoquel, that includes regular blood work and physical exams to make sure that I catch anything that's concerning before it actually becomes a problem, as well as working on finding the underlying cause of the allergy so that I can decrease the amount of Apoquel that the animal is taking throughout the course of its life. I'd like to make a brief mention about the use of Apoquel in cats, and there has been some investigation into the use of this medication as a therapy for cats with allergies. It is not currently FDA labeled for the use in cats, so it's considered an off-label use, which is allowed under the Animal Medicinal Drug Use Clarification Act, or AMDUCA. We just don't have as many studies looking at Apoquel in cats. Of the studies that we do have, they find that cats typically require higher doses of Apoquel to be effective compared to dogs. The medication doesn't last quite as long, which results in cats needing to be medicated twice a day. And for a lot of cat owners, that's a big drawback because of difficulties they have in giving a pill to their cat. For some cat owners, giving a pill one time a day is hard enough. Twice a day may lead to a cat revolution in the household. The higher dose and more frequent administration also significantly increases the cost of this medication for cat owners. So at this time, because there are only a few studies that have been published, because the twice daily dosing needed for Apoquel to be effective in cats, and because I have other FDA labeled products that work well for allergic cats, I still recommend other therapies such as steroids, atopica, and allergy shots. Apoquel overall has been a revolutionary medication for treating itchy dogs while investigating their underlying allergies. Overall, it's a safe medication to use both short and long term, as long as FDA guidelines are being followed and pets are being monitored with blood work and physical exams. If you have any concerns about potential side effects for your specific pet, I highly recommend you call your family veterinarian, discuss what's happening with your animal to come up with a plan as a team. If your pet has allergies, you can visit our website, yourvetwantsyouto.com, for references in the show notes from today's episode, as well as to subscribe to our email list to get a copy of our allergic dermatitis infographic and allergies toolkit. I've got a lot of great episodes coming up, not only more episodes on medications and different aspects of managing dogs and cats with allergies, but also expanding into other topics like internal medicine diseases, neurologic diseases, orthopedic diseases. Lots of good conversations coming your way with really talented veterinarians. So I recommend, if you're getting value from this show, please leave it a review and subscribe so you don't miss upcoming episodes. For all of you allergy pet owners out there, I look forward to your next visit with Your Vet Wants You to Know.